afternoon, everyone. Happy New Year, commissioners. Give me just 1 second. I had a bit of time.
Approval of a minute. That'll give Mr. Goodwin a minute to.
Of course, yes. Could you officially could you say the words, call the meeting to order, just so it's done?
Okay. Okay. So we are officially calling the meeting to order. And Mark, would you mind taking the roll call?
Sure, of course. I'll start with you, Commissioner Chong.
Here.
Commissioner Chow.
Present.
And Commissioner Guillermo.
Present.
All right, I'll read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. And we can go on to item 2, which is the approval of the minutes of the November 1st, 2022 meeting. And just a reminder to the public and anyone who watches this video in the future, the December 5th, 2022 Finance and Planning Committee meeting was canceled due to lack of quorum. Commissioner Chow did hold an information session and we did record it and it's on the website, but it wasn't an official meeting, so no action could be taken. I also have quick suggested edits from Commissioner Chow on the minutes. Number 1, the footer still said the October 4th date, not the November 7th, so that's just a basic correction. And then on page 4, under Baker Place's Positive Resource Center update, 3rd paragraph, the sentence should read, Mr. Wagner noted that there is a possibility that the DPH will have to either modify existing contracts with the organization or enter into contracts with different vendors. Dr. Chow suggested that I change the word contractors to contracts in that sentence. And those are the only suggested corrections.
Okay. Well, thank you. And with the corrections and the edits and corrections in mind, do we have a motion to adopt the minutes?
So moved.
I'll second.
All right, we have a
Okay.
public comment. Folks on the line, if you'd like to make comment on this item, which again is item 2 on this agenda, please press *3 to raise your hand. Every caller gets 3 minutes. When the timer goes off, please know that's your time to end your comments. Okay, caller, I've unmuted you. Please let us know that you're there.
Yes, it's Patrick Manetshaw.
Okay, you've got 3 minutes, Mr. Manetshaw.
Thank you. The meeting minutes included the $2 million contract amendment awarded to HMA. Commissioner Chow asked whether there would be additional contract modifications, and Baljit Sangha replied there would. Sangha misinformed Commissioner Chow by claiming Phase 3 regulations became effective October 24th, adding significant hours to the contract. Sangha wrongly asserted Phase 3 requirements weren't known when HMA's initial contract was issued in May. Phase 2 regulations aren't new. They were adopted in 2016 and took effect in 2019. Nursing homes were subject to Phase 3 regulations since November 28, 2019. LHH, if not Mr. Sangha, must have known for 3 years the Phase 3 compliance assessment inspections were coming. The only thing new is the missing interpretative guidelines limiting state survey agencies' assessment of Phase 3 requirement. Non-compliance has now been developed and incorporated into California's State Operations Manual survey process. Surveyors began using that new guidance on 10/24. Sangha's misinformation exemplifies the type of LHH mismanagement that should be documented in the root cause analysis report. Clearly, Mr. Sang wasn't aware that those regulations were effective and that it was only that there had been a delay in the state surveyors getting guidance to go ahead and spot non-compliance. Mr. Sangha should not be an LHH co-incident commander if he doesn't know these basic details. Thank you.
Thank you for your comments. That was the only public comment. So Commissioner Del Toro, roll call vote. Commissioner Chow,
Yes.
Commissioner Guillermo,
Yes.
and Commissioner Chung.
Yes.
All right, thank you. The minutes are approved with the corrections noted, and we can move on to item 3, the monthly contracts report.
Thank you, Mark. Good afternoon, Commissioners. Happy New Year. From the Health Commission report for this month, we have 8 items. Wanted to let you know that with the timing of the holidays and due to some last-minute conflicts, we have had a few challenges confirming some representatives to be available to answer questions you may have for a few of the items today. I see that we do have Baljeet available, but in case if he needs to step off, we have Rob Longatano, the Director of the Contracts Unit for the DPH Business Office, who may be able to help with answers, to help answer questions from the Health Services Advisory Group contracts. We have Kelly Hiramoto from the DPH Business Office to respond to questions you may have related to the Chinese hospital contract. And for the first item that I will introduce next, I will attempt to field any questions you may have or can follow up to collect more details and send those back to Mark after today's meeting. The first item we have is for Richmond Area Multi-Services for adult mental health services. Today we're requesting approval of a contract amendment with RAMS for $61,994,663 to extend the contract end date to 12/31/27 from 12/31/22, or to extend by a total of 5 years. The Health Commission previously approved this contract in November of 2018, and the amendment is authorized under RFP 8-2017, RFQ 18-2014, and RFQ 20-2019. Part of the request of this approval of a total of $61,994,663 is for an annual contract amount of $7,013,128, which will increase by $1,026,221 due to some removal of one-year funding from previous year's contracts, additions of new one-year funding, and adjustments of other funding, and additions of cost of doing business and COLA increases as detailed in the Health Commission report. We do not have anyone available to answer questions other than myself, and I can follow up with DPH staff as needed if I'm unable to do so.
Commissioners, any questions or comments? Sorry about that.
Just one comment. I really appreciate the reason stated in the contract report for this item, because it's really straightforward. And I hopefully, like this is the kind of communications that we have, moving forward, and that will save everybody's time. Thanks.
Thank you, Commissioner.
Commissioners, anyone else?
I had a question, just to, it's minor technical thing on the reason for funding change, number 4. It says move outpatient peer counseling services, move to peer contract. I'm not quite sure what that meant.
Number 4.
Under reason for funding change?
So they removed a one-time MHSA increase for the adult and outpatient of $126,720. That was a one-time increase. So they've removed it from the total because it's comparing the total to last year's amount. So they're
That's number 3. I was looking at the one right after that.
oh, I'm sorry, move outpatient peer counseling services to peer contract. I will find out for you, Commissioner Guillermo, what that
Can-
55,000 is in relation to and get back to you offhand. I'm not sure.
Michelle, it looks like Michelle had a.
Yeah, I can respond to that. RAMS has a few different contracts, and one of their contracts is we call it peer-to-peer services. These funds, that $55,000 was moved out of this contract and into their peer-to-peer contract because it's a peer-based, it's an intervention, or it's a service that's provided in their outpatient programming for people. I think it's for people stepping down. To ensure, for more intensive to less intensive, to help them make that transition. And so we moved that funding into the peer contract so that all the peer services were in the same contract.
Okay, so it's like sort of a consolidation.
Correct.
Okay, thank you.
Thank you, Michelle. Any other questions?
I think we can move on.
Okay, second item we have is also a RAMS contract. This is for Children's Services. We're requesting approval of a contract amendment with the RAMS contract to increase the total contract amount with contingency to $56,004,755, and to extend the contract term from 12/31 to 12/31/27 from 12/31/22, or to increase by 5 years. The Health Commission previously approved this in February of 2019. The amendment is authorized under RFP 8-2017, RFQ 18-2014, and RFQ 20-2019. The total amount of the contract, as I said, is $56,004,755. The annual amount without contingency will increase by about $276,856 due to adjustments in the mental health, CYF county work order, CODB adjustment, and other adjustments to increase or decrease various work orders, of which there are many that are detailed on your Health Commission report in front of you today. If you have any questions, Farah Faramand, the Director of DPH's Children, Youth, and Family System of Care, as well as Allison Lusbader, are here to respond to questions regarding the BOCC monitoring report that were submitted through Mark earlier today.
Commissioners, any questions?
I'm not sure because RAMS had so many programs. Is this where we can ask about the Fuyao analysis by staff, which had a statement that while they didn't construct meaningful performance objectives, it wasn't really very important? Or is that, did I miss it from the previous RAMS contract?
Commissioner Chow, is that from the performance backup document?
Correct.
Okay, thank you. Allison or Dean, any response? Or is this the right contract for that?
So, I'm sorry, so Commissioner, could you repeat the question? Was the question about why their performance objectives were low, and the response was that we weren't considering that for this year?
Now it says here that they failed to construct meaningful performance objectives for this program and have not done so since fiscal year 18-19, which should not be considered a program deficiency. So if you haven't done something, I would think it's a deficiency, whether you're waiving it because of COVID or what. But if it weren't a program deficiency, why are we asking for meaningful performance objectives?
This is Fuyao, right?
Yes.
Allison, I guess I can jump in because it's
Yes.
related to the early childhood mental health consultation.
Okay.
Commissioner, my name is Min Tan. I'm the Director for School-Based Mental Health Services under the Children, Youth, Family System of Care and Behavioral Health. So I'm managing Fuyao's contract. This is a program that sending clinicians to childcare centers. The clients there are babies, 0 to 5. Their purpose is helping the childcare providers to extend their ability to understand really young kids' mental health and help them to even for their own wellness. So then answer the question about the performance objective. This program always have a good set of performance objective based on consumer survey, right? Consumer feedback, you need to reach certain percentage of satisfaction. But since 2019, it's entered into a new RFQ. And it is a joint funded program with the new Department of Early Childhood and the Department of Children, Youth and Family. So at that point, both the provider and the joint funder think since the new RFQ is such a new redesign, we really need to have a new consumer survey to reflect it. So at that point, decided just for a year, instead of objective from the consumer survey, we asked provider to give a written essay about their performance, their implementation of the new design as we design a new consumer survey. But then what happened is the pandemic. So we totally refocused this setting to provide in-person service. Actually, this is the setting from day one of pandemic. We still provide in-person service because essential workers, baby, need someone to take care of them so they can work in the hospital. So we really more focused on that for 2021 instead of something that seems to be not as a huge concern at the moment. But starting actually 21, 22, the joint funder did add significant performance objective. For example, number of unit of service, although the staff capacity is really at the half, but our provider can provide 85% plus the service. We also add another object about put the concern back into the childcare setting, which is not easy because the baby's health is most concerned. So we, at this point, I happily report all the early childhood mental health provider are providing in-person service at those kindergarten, preschool, as long as the site allow them to do so. So that's the second. Third, joint funder also commissioned a evaluation effort. So we hired the nationally recognized expert in this field, Indigo Culture Center, evaluated the performance of this whole initiative. We thought that was more a significant monitoring at the moment that really needed to guide our future RFP versus design a consumer survey, which we don't know even how to do that without an evaluation effort. So we can already finish the phase one evaluation effort, has 2 reports we can submit to the commission for that. The second phase of quantitative report, even say pre-test, protest, a lot more rigorous, is in the plan and progressing. So that's where it is at about performance objective for Fuyao.
Well, thank you. I mean, it's a important service, and your explanation certainly shows the commitment of the department for this very key service. So thank you.
Thank you.
Any other questions or comments, commissioners? All right, Mr. Goodwin, let's move forward.
Okay, item number 3 is a contract with UCSF Infant Parent Program to increase the total contract amount with contingency to $11,362,814 and to extend the contract end date from 12/31/23 to 6/30/24 or extend by 6 months. The Health Commission previously approved the subject contract in December of 2018. And the amendment is authorized under solicitation RFP 1-2017, mental health outpatient treatment services for children, youth, and families, and RFQ 16-2018 for early childhood mental health consultation, also referred to as ECMHCI. The department is requesting the total contract amount with contingency of $11,361,814. Which is an increase of $584,859. The increase is due to 7 different increases in CODB and COLA or 2 work orders, as you see detailed in your Health Commission report in front of you. If you have any questions, Min Tam is here from CYF again to respond to anything specific related to the infant parent program.
Commissioners, any questions or comments?
Well, I had a question off of the evaluation, and thank you, by the way, for the detailed evaluations. They're really very helpful, and we're beginning to see, I think, some of the ways that we're looking at outcome. And so under the UCSF Infant Parent Program, and I've learned new abbreviations, right, or IPP, as you say. It points out that the program met 0% of contract performance and 0 contracted units. So, um, what should we be making of that? I realize this says there are challenges, but what then is actually being asked, or according to that, we didn't do the program, and is that part of the dollars that we're continuing to give?
So,
Go ahead.
okay. You want to go ahead, Min? Mhm.
Okay, well, I could explain the IPP that one of the major program is again early childhood mental health consultation initiative that I explained for RAM. So first of the performance objective is still there, as I explained before. In terms of deliverable, they definitely did not. I think the 0% certainly not accurate. I don't know how the 0% will be put in that spreadsheet. I could definitely say fiscal year 2021, IPP did the whatever their capacity can allow and some. Then most of services then during this really wave of the pandemic infection, they are delivered through telehealth. I don't know whether that's the reason they report versus in person, they are mostly telehealth for the preschool and kindergarten setting. I think that's it. That I could definitely vouch and prove that they did their work as much their capacity can allow during fiscal year 2021.
Okay, now I appreciate that explanation. It's unfortunate if we are going to be writing comments and all, then I think that that type of nuance needs to be considered, because uh, just us being lay people reading it, it looks very odd. But your explanation, of course, makes a lot of sense, and it sounds like perhaps an interpretation of how you put in the number of units and all. But I'm satisfied that happens to be the same work, I guess, that we asked earlier, and that really, from what you're saying, is not only being done, but being done under challenging circumstances, and that's great. Thank you. I don't have any other questions on that.
Thank you, Commissioner. Commissioner Guillermo and Chung, any other comments or questions? Okay, then I believe we can move on. Thank you.
Great. Item number 4 is requested action is the approval of a 4-year contract with Booker T. Washington Community Services Center to increase the previously approved 1-year contract of $1,477,643 to a 4-year contract. The total contract amount with contingency in the amount of $6,274,757, and to extend the contract term of 7/1/22 through 6/30/23 to end instead in 6/30/26 for an additional 3 more years. The Health Commission previously approved the subject contract in October of 2022. However, the Health Commission memo was mistakenly submitted for only 1 year instead of the total of 4 years as it should have been done. The amendment is authorized under RFP 4 2022. The current annual funding for the Black African American Community Wellness Health Services being provided by Booker T. Washington contract is $1,319,324 for this first year, with an additional funding to include $1,372,097 for the term of 7/1/23 through 6/30/24. A total of $1,426,981 for fiscal year 24-25, and $1,484,060 for the term of 25 through 26. A total of $672,295 in contingency funding for the 4 years of this contract is also included. If you have any questions, Vincent Fuqua, Health Program Coordinator for Community Health Equity and Promotion, is here to respond. Thank you, Commissioners.
Commissioner Guillermo, I see your hand.
Yeah, I was just wondering, it doesn't look like there was an evaluation included on the spreadsheet. Is that because the error in the contract in terms of the number of years and it's not due to be evaluated, or?
It's a brand new contract. The services just began this fiscal year, and so usually the evaluations are due the year that follows each year of funded services. So there will be a evaluation done next year for the services that are being provided that will conclude in the fiscal year that ends June 30th of 2023.
And just while I'm asking questions, most of these on the evaluation indicate that the reporting has been suspended because of COVID. Will any of that reporting pick up in this year now, or we continue to see that reports are suspended during the pandemic?
Well, thank you, Commissioner
yeah.
Guillermo, for that question. While scores weren't provided for the monitoring reports in total, there were evaluations provided as far as you've been seeing, of the performance objectives and how well providers may have responded to those existing objectives, as well as units of service delivered and clients served. As far as when the total monitoring report will be scored, we are looking to have that begin again next year. I'm not entirely sure that determination has been completed and is certain at this point. In the past, site visits have been done remotely by desk audit with this data and information provided and put together in a report format, but with no total score provided because of the impact of COVID. But I believe that is in place, and I see Michelle has jumped on to respond to that question as well.
Yeah, just to reiterate what Dean was saying, is that the individual pieces were scored. They just didn't apply the larger score by the component category. The main change that's going to happen, that's starting in this fiscal year for fiscal year 21-22, right? So we're starting that cycle, is that those will be on site as opposed to desk audits. So that's the one change. And then unless there's a particular reason, then the planning is to score again. And some sections may have reasons not to, for a variety of reasons that we'll share as they come up. I don't have any off the top of my head to know, but in general, I think the scoring will be applied unless there's an exception, and then we would share the exception.
Thank you. Just since the scoring hasn't been done for a while, it might be helpful just to have a very brief overview of how that is going to get reinitiated once that gets started, just so that we have a baseline of understanding.
Definitely.
Commissioner Chung and Commissioner Chow, any other questions or comments on this?
No.
Oh, Commissioner Chow?
No.
Okay, great. So we can move on.
Hi, Mark. Can I just make a quick clarification?
Sure.
So Dean's Health Product Community Health Equity Promotion Branch, I actually represent Office of Health Equity for this contract, just for the record.
Thank you, Vincent.
You're welcome.
All right, Dean, let's move on.
Okay, item number 5 is approval of a contract amendment with Haluna Health to increase the total contract amount with contingency to reflect an amount of $6,057,413. Contract term will remain the same. This contract provides administration and support services to the disease prevention and control section in support of strengthening STD prevention and control for the health department. Of the $973,335 in annual funding, Haluna Health will receive 12.1% administrative fees in the amount of $104,285, with the balance of $869,050 going toward the PCHD programmatic costs. Again, that's the prevention and control section, strengthening STD prevention and control for the health department. The proposed amendment is authorized under RFQ 36-2017 Additional funding will continue to support the efforts to reduce and educate the San Francisco target population about STDs and other communicable diseases. The total contract amount contingency of $6,057,413, or an increase of $4,722,321, is due to the following four reasons: an increase in the amount of $761,566 from a supplemental grant award in the current year, an increase in the amount of $1,162,743 in the grant year for next year, an increase of $2,386,360 in the grant year for fiscal year 2025 and 2026, which will be about $1,193,180 annually, as well as an increase of $411,652 added to the 12% contingency value applied to current and future years. If commissioners have any questions, Program Manager Joshua Kristantiel, my apologies for mauling your name, Joshua, and as well as Stephanie Cohen, Medical Director of City Clinic, should be available to help respond to your questions.
Commissioners, any questions or comments? I don't see any hands.
I was just thinking there's a considerable added funding, which is great for this service. What would trigger that we should be doing this in-house rather than using a contractor to manage these?
It's an excellent question, Joshua.
So for the subcontract dollars, these are going towards work activities that we're not able to source in-house at the moment. So the bulk of the funding is going to PCS positions that have been created, but in the meantime, positions like mine, the program manager, was still a contract position until, well, my first day was 7 days ago as a PCS, but I've been working for over a year to manage these funds and to get the resources we need provided from within. So Haluna Health in the meantime is providing administrative costs and subcontractors for services that we can't immediately source from within DPH. One example of many is our diversity, equity, and inclusion contractor, who, after working with Veronica Shepard from the Office of Racial Equity, we found a contractor who's able to work for with us over the next year until we can come to partner with the new office that Veronica manages. Just one example.
Well, is there an intent to absorb these functions or to? I mean, you have not extended the contract, so I'm just wondering if that is sort of in the plans, or that this is because they have an expertise that we don't have and won't have, or shouldn't have.
I think it depends on the subcontracts. For the DEI one that I just mentioned, yes, we would like to absorb that with our own professional capacity, but the positions being created in that specific area are not yet filled. The office is just starting its work, and so we want to make sure that we're in line with the racial equity action plan starting now and not when we have the resources in the future.
Okay, that's fine. That was just a curiosity to see if we were interested in taking over some of the administration. That's all. Thank you.
I now actually I have a question for this. So wouldn't it be a little bit more objective if it's a third-party vendor that's helping with fiscal management and budget development versus in-house?
Can you say a little more of that question?
So like Dr. Chow asked, like if we can absorb that and, and build the capacity for DPH to do their own fiscal management and budget development. And my question is, like, wouldn't it like in terms of transparency, be actually more objective, like that, for a third party vendor, which is Haluna Health in this case, to provide that kind of services. So versus, a DPH employee doing the DPH budget and fiscal management.
That's a good question. I don't know that I have all of the information I need to respond
Oh
to it
no,
right
no, you
now.
don't have to have you don't have to have an answer. So, but this is just like a questions to think about. Because we are a government body, and like we want to be able to be as objective as possible and also as transparent as possible. So having a third party vendor would kind of help to meet some of those requirements.
Yeah, appreciate that.
If I could just add, this is Michelle Ruggles, I would just add that it's city requirement and our goal to hire civil service staff first. But in the event, you've seen contracts where we have fiscal administration for, particularly when we get a broad range of community-based small providers, which aren't set up to do contracts with the city, then this venue can help this type of contract. But also when we have grant contracts or grant funded contracts that are short term, and it's not conducive between the start and the end to get to hire civil service staff. So that's another way and reason that we sometimes put grant funded projects that have an end date inside this type of contract.
Well said. That's a big part of it. Yes.
And Commissioner Guillermo has a question.
Yeah, thanks for those explanations, but I'm just thinking in response to Commissioner Chow's initial question, then it may be helpful at some point, maybe in the next year, to get information about whether the capacity within the department has been built or those positions have been established to do the kind of administration and monitoring, and then whether it is either cost effective or appropriately objective in order to do so, since these are questions that have been raised in this particular instance.
Thank you, Commissioner. And I'm noting that Jenny Louie is in the meeting now, and hopefully has heard that comment, because that's probably a higher level response needed than Joshua. But thank you. I've noted it. Any other questions or comments, commissioners? All right. Thank you very much. I think we can move on to the next item.
Thank you. Item number 6 is we are asking for approval of a new contract with Chinese Hospital to continue existing services for a total contract amount with contingency of $9,891,840 for a term of 1 year from 12/1/22 to 11/30/23. Contracting authority is through RFP SF-Gov 6964. Proposed contract will retain the same number of beds. However, the licensure is intended to change from acute to subacute beds. The difference in the annual amount is largely due to annual increases in operating expenses. These beds were initially purchased as emergency and surge beds during the COVID pandemic. The original contract was presented to the Health Commission on February 1st, 2022. The department will utilize the next year to determine ongoing need prior to extending the contract any further. While this is a new contract, the continuation of previous COVID-19 was presented, as I said, in February of 2022. And the reason is for the change to subacute beds. The increase of $689,143 represents increases from the previous year to operating expenses. If you have any programmatic questions or any other questions, Kelly Hiramoto of the DPH Business Office is here to respond. Thank you, commissioners.
Commissioners, Guillermo and Chung, any questions?
I think this is also where we need to show on the record that Commissioner Chow has stepped away to recuse himself from this discussion.
Yes, I've noted that, and I will note that in the minutes as well.
Okay, thank you.
I just had I think it's a technical question. The change in total contract amount shows a decrease of over $10 million, but the actual contract is an increase. And so I was just wondering, from 19,000 to whatever the new amount is in total, why is that? Since the term is extended for a year. So I'm just not understanding that line.
Ms. Hiramoto, can you clarify? Let's see.
Good afternoon, Commissioners. This is Kelly Hiramoto. I'm a Special Projects Manager with the Department of Public Health. Thank you for your question. The annualized cost for doing business is because of the change in the cost of beds and the way the patients will be flowing through the bed. So we're going to be moving from SNF beds.
No,
Hopefully
I understand that. I just didn't understand, and maybe I'm just being dense here, but it shows that initially the total contract is $19 million.
yes.
And then the change in total is a decrease of 10 million, but the contract is actually being increased because of the increase in costs and the change from acute to subacute. So I'm just not sure where that 10 million decrease is coming from.
Because this contract term is only for 1 year, and the original contract term was for
Okay.
Yeah.
So then I was being dense. Thanks.
it's just the time. It's
I
the
got
time.
it. I got it. Okay.
Thanks.
For clarifying. Any other questions, Commissioner Chung?
No, I don't have any questions. And Commissioner Guillermo, I don't think that you're being dense. I think that's just being detailed. Okay.
All right, let's move on to the Central AIDS Foundation contract. Thank you.
Thank you. The next question, the next requested action is for approval of a contract amendment with the San Francisco AIDS Foundation to increase the total contract amount with contingency to reflect an amount of $51,164,612, and also to extend the contract term from a start date of 7/1/21 to 6/30/23 to end instead of on 6/30/31, or to extend to a total of 10 years. The Health Commission previously approved this contract on April 6th of 2021. This contract provides monthly financial assistance in the form of a rental subsidy to clients with disabling HIV or AIDS, including those who are imminently homeless and HIV positive clients, to help secure and maintain stable, safe, and affordable housing. Proposed amendment is authorized under RFP 39-2020. Additional funding will continue to support services under the HIV rental subsidies modality. The approved contract amendment with contingency for $51,164,612 reflects an increase of $41,756,979 due to the following reasons: the addition of a cost of doing business for the current and future fiscal years, additional general fund funding fiscal year 23-24 through fiscal year 30-31 for a total amount of $37,070,640. Or about 4.6 million annually, as well as an increase of the contingency to reflect this. The current contingency amount is $5,004,536. If commissioners have any questions, Beth Neary, Acting Assistant Director of HIV Health Services, is on board to respond.
Any questions, commissioners? Comments?
I just had a comment that we're now extending what was a 2-year contract to a 10-year contract, and our past precedent has been to sort of use 5 years as a benchmark to be able to review a contract again. So this looks like, is there some reason that we chose the full 10 years from an RFP and instead of extending it so that it either had a 5-year extension or 3 years to get to the 5 years. I mean, what was the reason for doing the extension now and all the way out to 10 years?
Thank you for that question, Commissioner Chow. We're preparing the budget and all the documents to take to the Board of Supervisors to get approval to go over the $10 million cap. And due to the amount of time and to schedule and prepare documentation for that process, we are extending the full additional 8 years through the 10 years approved through the RFP. Although HIV Health Services may actually instead opt to do a shorter contract to reflect that 5-year practice as you have referenced. But this will give us the approval and the authority by the board to go out through the full 8 years allowed by the RFP authority.
So you've decided to go to 8 years, even though there was a thought that we would go to 5 years.
The approval with we're taking this, we're bringing this to the Health Commission for pre-approval to go to the board to get permission to extend for the full 10 allowed or to an additional 8 years beyond the 2-year contract. At this point, due to the amount of administrative time and work to put those documents together. And we thought that the board would prefer to have this come to them once as opposed to again in another year or two. That was our thought in bringing this to you at this time in this manner.
Well, that logic would say that all 10-year RFPs would then be brought to us for 10 years. Just to, and I'm saying that's right or wrong. The rationale in the past had been that we wanted to actually see performance over a 5-year period rather than allowing a 10-year in terms of a contractor. So I think this may be more, again, an issue of, how the department is now thinking of these and asking us for a change rather than, us starting to see 8 to 10-year contracts right off the bat. I don't know if, Michelle has any thoughts about that, but she knows where we had come to a 5-year decision in terms of extending contracts or even though you got authority for 10 years under an RFP.
And also Beth Neary is here to, I believe, to answer questions. So Beth, feel free to jump in if you have a response that's appropriate.
I'll just say something very briefly and then hand it back to Michelle to respond more fully. We did very carefully consider the question. Our initial idea was to extend 3 additional years to get to 5 years and to then go through this process again at the 5-year mark. It generally is pretty onerous for the Board of Supervisors. Legislative analysts was our sort of understanding, and in addition, in this particular case, while the RFP they're only 2 years into their contract right now, the same vendor had previously provided this service for the decade prior and had very strong performance throughout, and currently has strong performance, so that we weren't concerned with that possibility. Though we're open to both.
I guess I would add, I completely hear what you're saying, Commissioner Chow, and I think it was because of that decision, but I think we should have flagged it and then probably brought that to you first. But I think it is because they have been doing this, and because of what the service is, and because they've been doing a good job. It's just to continue it. It's something that will continue administratively, and so that's why it really is a lot of work, which isn't that, right? We still do it, and we still go with shorter contracts, and in fact have been looking at shorter contracts, going to the board also for their comfort level as well. But I think this one, as Beth Neary was saying, with the contract analyst, they pulled it out simply kind of because of what the service is and the track record. So,
and the kind of like task they perform is actually pretty straightforward, right? Most of the money that goes into this program actually goes into subsidies. So, which means that, that's just a very small administrative cost to this. So there's like fewer questions about, you know, like how the money is being managed. Am I correct?
That's correct. And I would imagine Dean Goodwin, who's did this in his prior job, could speak to that more. But I think you're exactly right. There's a small amount that goes to the San Francisco AIDS Foundation, with the bulk of the money being paid out as the stipends. So it is very much a more administrative contract.
Well, yeah, I'm not, you know, saying that. What I think I'm hearing is that this isn't necessarily a change from the policy, but the circumstances of this contract and the performance of the foundation, as Commissioner Chung alluded to, is actually not in question, and it would be helpful to just, you know, be able not to have the hassle of redoing it, and that this was not a change of the policy that we would like to see, unless the commission makes a, you know, new determination that they would go with 10-year contracts. And so I'm glad that there was a discussion about that, and I can understand the circumstances here. And I think we shouldn't forget also that we haven't had the push lately, but there's been, you know, in the past, the push that all of our contracts seem to keep going to the same people, and we never seem to have a new group of providers. I will admit that every time we put these out, we get the same providers. But I do remember that that is a pressure from the public to say that you need to open up the opportunities, even though there may not be people who are actually willing to do this. So I think all of these are just part of the mix. I understand the circumstances here and really appreciate understanding that. But if there is an intent to try to change the normal term of giving contracts, I suggest that, you know, we talk with the chair of the committee and back to the committee as to dialogue about that.
And I would just add that in these instances where there is either an exception or something that, you know, may cause question, that it is important to flag it for us so that we don't have to go into these sort of involved Q&A periods, you know, during the meeting, that there's something that we might be able to ask, you know, as the materials are being presented to us or sent to us in advance. I mean, you know, if things are, you know, unusual or different from the established procedure, or whether there's something that's going to cause some, you know, as you say, you know, a difficulty in preparing for, you know, for the future in this, you know, as is the case in this instance. But I just think it's helpful and in some cases necessary to flag for the committee anything that is sort of deviant from what our understanding would otherwise normally be.
Thank you, commissioners. We'll be sure to flag that. That was we had a quite a conversation internally about how to proceed with this as we were making the decision on how long to take this to the board. Thank you for that feedback.
All right, I believe we can move on to the last contract.
The last contract is with the Asian and Pacific Islander Wellness Center, doing business as the San Francisco Community Health Center. It's the approval of a contract amendment to increase the total contract amount with contingency to reflect a total of $15,443,256, as well as to extend the term for 3 years from an end date, from a start date of 5/1/2017, ending 2/29/24, to extend to 2/28/27, an addition of 3 years. The Health Commission previously approved this contract on March 6, 2018. Contract provides for integrated case management, Tenderloin Area Center of Excellence, or also known as TACE, and Tenderloin Early Intervention Services for the H-Home and Trans Access Program, which includes direct support through integrated medical case management, outreach to HIV positive homeless, and intervention services. The proposed amendment is authorized under RFP 16-2017. Additional funding will continue to support the medical case management ambulatory outpatient medical care and trans-access modality. The requested approval of $15,443,256 reflects an increase of $5,787,933 due to changes in funding to the Ryan White Part A Ending the HIV Epidemic Grant funding for the Tenderloin Early Intervention Services at H-Home and Trans-Access Program in the amount of $120,000 for fiscal years 2022 and 23 and 23-24, or an amount of $63,000 annually, as well as other increases from the Ryan White Grant in CUDB as detailed in the Health Commission report in front of you. If you have any other questions, again, we have Beth Neary from HIV Health Services to field those for you.
Commissioners, any questions or comments? I'm not seeing any hands. I think that means we can move on.
Great, thank you.
Great. So commissioners, I need to call for public comment, but before we do that, I wanted to just note that when you all motion to vote, because Commissioner Chow has a conflict, you all need to do motions and vote to extract the Chinese hospital contract for a separate vote. And then all three of you can vote for the contracts report minus the Chinese hospital contract. And then Commissioners Chung and Guillermo, you two can vote for the Chinese hospital contract without Commissioner Chow. Before we do all that, I want to open up for public comment for folks to comment on this item. So please press *3 if you'd like to make comment again on item 3, the monthly contracts report. I see one hand. Hi, caller. You've got 3 minutes. Please let us know that you're there.
Thank you, Mr. Morwitz. This is Patrick Manetshaw. Regarding the Chinese hospital contract, how many of the 23 beds are dedicated to regular SNF patients? How many are dedicated to subacute SNF patients? I believe regulations prohibit, quote, flexing, end quote, regular SNF beds to subacute SNF beds and vice versa. Why wasn't this contract made available for public inspection prior to being presented to the Health Commission? Are the subacute SNF beds only for SFGH patients, or will they be available to all San Franciscans? What happened to the Chinese hospital previous intention and plan to host and make available a 23-bed subacute unit for the entire city? Are the subacute beds in this particular contract part of the city's larger efforts to find and open up to 90 subacute beds to replace the subacute unit CTMC shut down at St. Luke's Hospital in 2017? If not, when will this commission begin identifying and funding another subacute unit, since the city now has 0 subacute beds available anywhere? Is this part and parcel of what the Board of Supervisors, Public Safety and Neighborhood Services Committee has been looking into to solve the subacute SNF crisis in San Francisco? Thank you.
Thank you for your comment. And commissioners, just for you to know, the full commission is going to be getting a report or presentation on subacute services sometime in early spring. It'll be either March or April, and I believe some more of this will be discussed then. So just for you to know, as well as a member of the public to know, there'll be more information coming around all of this, not specific to this contract around that time. All right, so commissioners, let's begin with a motion to extract the Chinese hospital contract, please, from the contract report.
I'll move to extract the Chinese hospital contract.
Okay, and all three of you can vote on this. Commissioner, I'm sorry. Okay, great. I'll do a roll call vote. Commissioner Guillermo?
Yes.
Commissioner Chow,
Yes.
and Commissioner Chung.
Yes.
All right, thank you. So since the Chinese hospital contract is put aside, you all can make motions and vote on the rest of the contracts report. So can we please have a motion to approve that document?
I'll move approval of the report.
And I would second that.
Okay, great. And again, this is the report minus the Chinese hospital contract. I'll do a roll call vote. Commissioner Guillermo,
Yes.
Commissioner Chow,
Yes.
and Commissioner Chung.
Yes.
All right, that document is approved. And Commissioners Chung and Guillermo, please do motions to approve the Chinese hospital contract on its own.
I'll move approval of the Chinese Hospital Association contract.
And I second. So the motion carried.
Yes, and my verbiage was incorrect. I want to make sure that we're clear to the public. What you all were voting on was recommending to the full commission approval of both of those. So I apologize for that, but thank you. Both of those are recommended for approval to the full commission. And now we can move on. And thank you everybody who staff and vendors who were here to support that. Item 4 is a request for approval of a new contract with Health Services Advisory Group to perform additional consulting services. And Baljeet is here to give us more information on that.
Sure, thanks, Mark. Good afternoon, everyone. I'm Baljeet Sangha, Chief Operating Officer for the San Francisco Health Network, currently also serving as the co-incident commander for the Laguna Honda recertification. So before you is there are going to be 2 contracts for HSAG for discussion. I believe the first one is our non-QIE contract. And so, great, thanks, Mark. So what this is a request for an approval of a new contract with Health Services Advisory Group to perform the additional consulting services that build upon the previously completed services that concluded calendar year December 31st, 2022, and additional performance improvement services in support of the recertification. Now, building on the work that's already been completed, HSAG will provide dedicated performance improvement teams, which will provide technical assistance, targeted support to Laguna Honda to continue to work towards CMS recertification, participate as subject matter experts in pertinent committees, provide a nursing home administrator, director of nursing, expertise on the closure plan, infection prevention, quality assurance and performance improvement, and behavioral health consultation. Now, they're also going to be doing some work by developing resources and curriculum that will continue to build on the instructional sessions that we have in place for as many topics as identified, such as the work that's being done with the action plan development actively underway here at Laguna Honda. This group will also be key in participating in advising Laguna Honda and selection and interviewing candidates that are considered for leadership positions as we build towards a long-term structure here at Laguna Honda for our leadership and our management. So that's really the overall scope of the contract. And then there are a couple questions that I want to make sure I address in terms of how it's listed and phrased. One in particular related to the nomenclature of the names and titles. And I know there's a slash that's being utilized. So I want to call out one, for example, that the senior nursing home administrator is not the same as the senior director of nursing. Those are 2 distinct roles, but they are coupled together because they are a similar invoice line item rate. Additionally, this contract calls for 3 FTEs of either a nursing home administrator or a senior director of nursing, and up to 6 to 8 FTEs of quality specialists. And so I use FTE as a full-time equivalent because that is a 40-hour work week, but sometimes there might be individuals that partner up where it's 20 hours from one individual, 20 hours of another individual. And while that's 2 individuals, that would equate to 1 FTE. And finally, regarding the cost per hour of each of these staff, these are indeed higher than what you would traditionally see for consultants or project managers. But the key distinction here is that this is a group, as I just enumerated with the description above earlier, is that this is advising and consulting, not in the traditional sense. This is actually more than advising what to do. This is the actual doing of it. This is the actual walking the floors, actually doing the trainings. Sometimes when you see traditional project management, it's more of a coordination of ensuring individual entities as part of a project are completing certain tasks. or they are providing consultation and suggesting or advising on what should happen. The key for this role of HSAG is they're actually doing, in addition to advising on what needs to happen, they're actually participating as SMEs on pertinent committees. They're actively engaged in the conversation dialogue. And so we do see a higher billable rate for this work. And this work itself also is being specifically focused and nuanced, given the role and the sole source nature of HSAG, meaning they are the unique entity that has the designation of a quality improvement organization with CMS. No one else has that for this region. And although HSAG is not here as a QIO, they are an individual that holds that distinction by virtue of this of their relationship with CMS. This contract, though, is a direct contract with HSAG directly with the Department of Public Health and Laguna Honda. So I'll stop there. I wanted to make sure I got through the what the contract is, what it does, and hit some of those questions. But I'm happy to answer or field any other questions that the commissioners may have.
Thank you. Commissioners, there is a hand up, and I want to ask other folks on the line if they have public comment on item 4. And this is the request for approval of a new contract with Health Services Advisory Group to perform additional consulting services. This is, again, not the QIE contract, but the other contract. If you'd like to make comment on this, please press *3. I see one hand. Mr. Manetchal, you've got 3 minutes.
All right, thank you, Mark, for being
Oh, I apologize, sir. I muted you instead of myself. Please go now. You've got 3 minutes.
All right, thank you for being prescient that it was in fact me on the phone. Between HSAG's first contract in May, First Amendment in July, the QIE contract you'll discuss in a moment, in this new contract, HSAG has been awarded $17.3 million to assist DPH's quest to obtain full CMS recertification for Laguna Honda. HSAG's hourly rate increases since its published rates in June have padded $1 million onto this new contract. Between the first contract, First Amendment, and this new contract, DPH is essentially renting HSAG consultant staff to perform the roles of a nursing home administrator and assistant nursing home administrator positions at a combined cost of $3.1 million, according to the units of service itemized in the First Amendment in this new contract request form. Laguna Honda should have just hired those 2 nursing home administrators, which likely would have cost well under $500,000, not $3 million. This commission should expedite a nationwide search and simply and rapidly hire nursing home administrator staff at Laguna Honda to save money by not using $485 per hour HSAG staff to fill these 2 positions. To me, $485 hourly rate sounds like price gouging. Thank you.
All right, thank you for your comments. That's the only comment we have on this item. Commissioners, any questions or comments from you?
I'm sorry. I was trying to hit the unmute button. I'm curious. This is a 1-year contract, but in the course of this, we might be adding expertise. Is this as used, or this is absolute? And whether or not we use all these services, we're paying them a fixed contract.
I'm sorry, Commissioner Chow, I've had some difficulty hearing the latter part of your question. Would you repeat that if possible?
Sure. The question is, in this contract, is this as services used, or is this just a flat contract? And whether or not we use all of these services, they're going to get $7,100,000.
It's not the latter. This is billed as actuals. So as we evolve and continue with the work that's being done, and for example, one of the examples of the work I described here was that HSAG would be participating in the selection and helping us develop the appropriate right size job description for the candidates that we want to bring on board to actually take on these key leadership positions in the long term, so we can have it hired onto city and county classifications and part of the Laguna Honda team. Now, once that occurs, then the reliance on the consultants in those roles, there certainly will be some overlap, but then as that reduces, then the invoices and the actuals would reduce. So it's not a guaranteed amount for this contract. We are billing actuals as incurred, and this certainly does align with our city and county of San Francisco general process, which is we approve invoices for payment once services have been rendered and received.
Okay, no, thank you. Appreciate the clarification.
Sure thing.
Commissioners Chung or Guillermo, anything else? All right, so I believe we are at a place where you all could have motions to approve this contract, or to recommend the full commission approve the contract on the consent calendar.
I'll move approval of the contract or recommendation of the contract approval to the full commission.
I would second that.
Okay, I'll do a roll call vote. Commissioner Chow,
Yes.
Commissioner Guillermo,
Yes.
and Commissioner Chung.
Yes.
All right, thank you. This is on the consent calendar and recommended for approval by the full commission. We can move on to item 5, which is a new contract with Health Services Advisory Group to perform services as the Quality Improvement Experts, or the QIE. And again, Baljeet is here to present.
Awesome, thank you. So this will a bit more of a shorter explanation here, but then certainly would love to answer any questions. So this particular contract is distinct from the previous one we just discussed. This is the HSAG contract, or Health Services Advisory Group contract, where they are serving as the Quality Improvement Expert. Now, the Quality Improvement Expert was a required designation and a required relationship to enter into as part of the settlement agreement that was reached a few months back with CMS and the City and County of San Francisco involving Laguna Honda. Now, as part of this role, the QIE, which is in this capacity, the QIE reports directly to CMS. And as the settlement agreement identified, we do have to set up a contract with the QIE for this relationship and the scope of work, and we are responsible for the invoicing of it. However, this is in terms of the chain of communication and approval process, much of this routes directly from the QIE directly to CMS. Now, in this role, the QIE is responsible for developing an analysis on all the factors that led us to decertification in April 2022, and also they're responsible for identifying all the factors that contributed to any other subsequent findings since April 2022, which includes any other surveys that we've developed. And so, in terms of this scope, this group and HSAG, as they're wearing their QIE hat on, they are also partnering with us for developing action plans, which are equivalent to what we would call a plan of correction. But an action plan is aimed to then address and fix or implement interventions that will address the factors that led us to the original finding. Now, regarding a question of what additional services are being provided besides the analysis, I do want to highlight that the QIE and HSAG will not just exist in the development of the action plan. It's their responsibility to, for any additional deficiencies or findings that occur hereafter for any other surveys, such as the monitoring surveys that occur every 90 days, that the QIE is also responsible for performing an analysis on the factors that lead to any future findings. So they will have to update their findings. They'll have to continue to partner with Laguna Honda to update new action plans. And then through it all, the QIE is responsible for providing ongoing monthly reports back to CMS around how the milestones are being met. So this is a relationship and in a discussion that happens directly with the QIE and CMS, but these are all part and parcel of the additional services that are being provided here in the contract. I hope that hits one of the questions that was raised earlier. I'll stop there. And if there are any other questions, happy to field them.
All right, folks on the public comment line, if you'd like to make comment on this item, please press *3. I see one hand. This, again, the item we're on is item 5, the approval of new contract with Health Service Advisory Group, and this is the QIE contract. Mr. Manette-Shaw, you've got 3 minutes.
Mark, you are very precise. Yes, it's me. The QIE contract requires producing the root cause analysis report and the action plan due for submission just 3 days from now on January 6th to CMS. The root cause analysis purpose was to determine factors precluding Laguna Honda from achieving and maintaining substantial compliance with federal reimbursement participation requirements and to ensure long-term substantial compliance in the future. Did the RCA report record and include that Laguna Honda CEO Roland Pickens admitted to this commission last August that LHH had been following the wrong regulatory guidelines by using California Title 22 acute care hospital guidelines, not using CMS's skilled nursing facility regulatory guidelines, thereby causing substantial noncompliance. If Pickens' admission was not included in the RCA report, then HSAG did a terrible job writing it because following the wrong guidelines was clearly a substantial contributing factor to being decertified. HSAG should have provided a copy of the RCA to DPH, and DPH should have made the damn thing public instead of hiding it, saying that they didn't have access to the RCA. Members of the public deserve seeing the RCA, and the Health Commission should make damn sure that it is released to members of the public now. Thank you.
Thanks for your comments. Commissioners, that was the only comment. I see Commissioner Guillermo's hand on this item.
Thank you. I'm just wondering whether there is any overlap in the personnel consultants between the QIE and the previous contract that we recommended for approval.
Thank you, Commissioner Guillermo. No, there's not an overlap. They are distinct and separate individuals to maintain that level of just balance between both of the distinct scopes of work.
Thank you.
Ciao.
Let's see. Commissioner Chung, is it okay to ask a question?
Yeah.
I didn't hear you. That's why I was just, I think momentarily muted or got muted. But the question is, and I appreciate the explanation given for the relationship with the CMS people. So I just want to clarify that although we are putting together this contract to pay for the QIE to do the RCA, in accordance to your statement as a settlement, actually goes to CMS and not to us. And that therefore also the ASAG group is to help us prepare a response to CMS that CMS gets, and then we won't get that until CMS approves it. Is that right?
Yeah, that's correct. Just to repeat back to make sure clear and explicit in the response. So yes, the any kind of analysis that's occurring, the work product or the output of that work product from HSAG is then delivered to CMS, who then has to approve it. anything, and so they are the author of any of those analysis for the factors that lead to any particular findings. For any action plans, the HSAG QIE are supporting and they are advising and they're providing some additional guidance on action plan development, but they are not the authors of that document. Action plans are the, Laguna Honda is the author of those documents. Both documents, including the action plan, still requires an approval by CMS. And CMS has a designated time period to then make that final approval, at which point then the document can be deemed as final for that particular document for whatever was turned in. So I just want to draw out that nuance a bit there in terms of when the item or the output goes up to CMS. CMS has the approval authority for both types of documents, and then at that point, then they become, particularly the action plan will become available for us back to us as an author in its full finalized form.
Right, so it's sort of like in a survey process, although we might hear things from a surveyor, nothing is really official until we get back something from the organization. So in this case, the CMS, we don't really have a report until CMS gives it to us.
Exactly, that's a fantastic comparison. And until it's finalized by CMS as they have approved it, then we can never definitively say that this is the final document.
Okay, no, thank you. No, is this also a contract that is for services rendered and not just an absolute, right? Depending upon how much time
Correct.
it takes them to
Correct.
answer.
My earlier response on the record also applies here. These are for actuals of services provided, and then the invoicing would be approved and paid out on services actually rendered and received.
All right, thank you.
Commissioners, any other questions on this or comments? Could we have a motion to recommend to the full commission for approval?
I'll recommend approval to the full commission.
And I would second that.
All right, I'll do a roll call vote. Commissioner Chow,
Yes.
Commissioner Guillermo,
Yes.
and Commissioner Chung.
Yes.
Thank you. This is on the consent calendar, with a recommendation from you all for the full commission to approve. Thank you very much, Baljeet, for taking time out of your really busy schedule to come and present today. Take care.
Fantastic. Thank you, commissioners. Thank you, Secretary Moritz. Have a good day, everyone.
Bye. Happy New Year. Item 6, request for approval of a new contract with Trifacta to perform temporary as needed radiology registry services. And I believe we have Loretta Johnson to present.
Actually, it's Valerie Williams.
I apologize. Yes, hi.
No, it's okay. It's as you said, for Trifectas to perform temporary as needed radiology services. And this is with regards to ZSFG in regards to our radiology department dealing with our CT, MRI, ultrasound, our radiology assistants, and also for mammography. So as needed services for the vacancies, right now we have a very large set of vacancies that we've been trying to fill. With the pandemic hit us pretty hard, folks going out. So these are, before we only had 2 contracts that we relied upon. And with what has been happening in the industry, those particular 2 vendors actually have been used by the entire Bay Area. So it's very hard for us to get registry folks in. And this time around, we were given, I guess when the RFP was put out, it was put out for 4 different vendors to come in for our as-needed contracting services. So at this particular point, we now have Registry Network, who has already been approved. We only have 1 vendor currently that we are able to access for registry services.
Thank you, Ms. Williams. Before we go to commissioners' comments and questions, folks online, if you'd like to make comment on item 6, the request for approval of new contract with Trifacta, please press *3. I still see, Mr. Minetshaw, I see your hand. up. I'm not sure if you meant to have it up for this item.
I do want to speak, Mark. Can I go ahead?
Yes, I have the timer on now. You've got 3 minutes.
Okay, I'm not going to take 3 minutes. I'm curious on the trifecta contract. It's specifically for radiology services, but it indicates that some of the radiology services may be performed at Laguna Honda. I thought most of the radiology staff at Laguna Honda had been disbanded years ago. So I'm just curious if you can answer whether the previous contract with Trifecta to provide nutrition staffing and social worker staffing has now ended as of December 2022, and whether this contract will continue providing staff from Trifecta to Laguna Honda for services other than radiology. It would be helpful to have clarification on that. And because of the static in the equipment, when Mr. Sang had just replied to Commissioner Chow's question about the contract for the QIE, could you clarify, given the static, whether I heard Mr. Sang correctly, that if CMS has approved the root cause analysis report is supposed to be used to incorporate into the action plan, is that CMS approved root cause analysis report now available to members of the public? Please consider answering that question, even though I know you're not required to. Thank you, Mr. Morowitz.
Thanks for your comment, Mr. Minette-Shaw. Commissioners, do you have any comments or questions about this contract, which is the Trifecta contract to perform radiology registry services? And if not, then would you consider a motion for approval or a recommendation for the full commission to approve?
So moved.
Second.
All right, I'll do a roll call vote. Commissioner Chow,
Yes.
Commissioner Guillermo,
Yes.
and Commissioner Chong.
Yes.
All right, thank you. This is put onto the consent calendar for the full commission to consider for approval. Item 7 is a request for approval of new contract with Maxim Healthcare Staffing Services. Sorry about that. To perform temp as needed radiology registry services. And again, I believe Ms. Williams is here to present.
And before we go to the contract, can we do a time check, Mark? Because I know that we still have another presentations after all the approval of contracts. Will we have enough time for that?
Commissioner, I don't believe we will, but that's up to you all. Ms. Louie has been on here and has checked in with me a few times about the time check. The quarterly financial report is an important presentation. I mean, you all need to, I think, have at least 15 or 20 minutes to discuss, but why don't you all discuss and see if you want to postpone or how you want to interact with it, because the contracts need to be discussed and before you all move on to the presentation.
Okay, so you know my suggestion. So, but let's finish these contracts and then we will defer the other ones.
Okay, well, you'll see. All right, Ms. Williams, anything new on this to present?
Nothing new on this. It's the same as with Trifecta. This is one of the vendors that was selected brand new to contract. And it's my understanding as I was reading through the contract, Maxim also has been providing nursing registry services. So nothing new to report that's different from the Trifecta contract.
All right. Folks on the line, if you'd like to make comment on item 7, the Maxim Healthcare Staffing contract request, please press *3. I see Mr. Minette-Shaw has his hand up. Would you like to make a comment, Mr. Minette-Shaw?
No, thank you, Mark.
Okay. So commissioners, any questions or comments on this? And if not, would you like to make a motion to recommend the full commission approve?
I move approval.
Second,
All right, I'll do a roll call vote. Commissioner Guillermo,
yes.
Commissioner Chow,
Yes.
Commissioner Chung.
Yes.
All right, so the item is on the consent calendar for the full commission to consider for approval. Item 8 is a request for a new professional services agreement with NetSmart Technologies to perform specialized information technology professional services for Avatar. And I believe we have Kim Volker here still to present.
Yes. Hello. Yes, so this new contract is to provide services for application support, for build analysis, for configuration, and general support, especially to meet the requirements for CalAIM for both payment reform and documentation reform for behavioral health services. I just wanted to mention with this, we'll be utilizing contractors for several one-time efforts, primarily related to CalAIM. We're in the process of hiring, and our long-term goal is to support these efforts through PCS union employees. So I can open it up for questions.
Let me first check with the public. Folks, Mr. Minetshaw, your hand is still up. Would you like to make a comment on item 8?
I'm not making any comment, Mark.
Okay, great. All right, commissioners, any comments or questions? All right, and if not, any motion for approval for the full commission to approve?
I'll move a recommendation for approval.
And I would second that.
Okay, Commissioner Guillermo,
Yes.
Commissioner Chow,
Yes.
and Commissioner Chung.
Yes.
All right, this is also added to the consent calendar. Thank you, Ms. Volkner, for your patience. And so,
Thank you.
commissioners, how would you like to proceed? We are at 3:40.
Yeah. So I think because of like the, like the time that would require, for the financial reports presentations and also for discussions, it would be doing Ms. Louis a disfavor if we try to rush her through it. So can we actually table this and then make this, the first item on the agenda for the next finance and planning meeting?
I can certainly try to do that. I'll check with Ms. Louis about scheduling, and commissioners, I can never predict the number of contracts on the contract report or a new contract request. So I can't predict the agenda will be shorter or smaller next meeting, but we'll work on it and we'll try to figure it out if that's what you
Well,
think.
the other thing is to like bring it to the full commission and have to make sure that, like we have this agendized and had, like the presentation. So, this has to go through the full commission anyway. This is something that all commissioners should have.
Yes. Well, just for y'all to know, when Mr. Wagner was CFO, he came to an agreement with, I think it was Commissioner Chow when he was president, that the first and third quarterly reports would come to the committee and the second and fourth will come to the full commission. And so, of course, all the commissioners get all the information, but it's not always presented at the full commission. But either way, I will work on this and I'll be in touch with you, Commissioner Chung, before the meeting next month to figure it out.
I'm just concerned that, like if we have as many contracts, to approve next time, then we will like run into the same issue. So we might have to revisit that anyway.
Okay, no, thank you. And Ms. Louis, we apologize because commissioners, you don't know this, but we bumped Ms. Louis last time because the meeting was canceled due to lack of quorum. So this is the second time that we bumped her.
No.
Not that the materials are very important and we realize that as you're stating, Commissioner. So we will put it on the next month's agenda. Okay, so there's a few more things we can move on to then. Item 10 is emerging issues.
Well, I was just going to comment on the previous, which is sort of an emerging issue. I think with Mr. Wagner, our decision was made because the first and third were kind of interim reports, and that way then the full commission would get much better information looking at the semi-annual itself rather than it going to the Finance Committee. The Finance Committee sees the first and third. Obviously, I think Commissioner Chung has a good point. If we are running behind, it would be proper to speak with finance and with our officers to see if they would then like the whole thing, brought to the full commission rather than waiting another, month. So I think that I just wanted to add that as a comment for discussion.
Thank you, sir. Any other comments or questions from you, commissioners, before I go to the public? All right, folks on the line, if you'd like to make comment on item 10, please press *3 to emerging issues. Mr. Manette-Shaw, you've got your hand up. Would you like to make a comment?
Yes, sir.
Okay, great. And then commissioners, item 11 is general public comment. Folks in line, if you'd like to make general public comment, please press *3. All right. And then item 12 is the consideration for adjournment.
Move for adjournment.
Second?
I'll do a roll call vote. Commissioner Chow,
Yes.
Commissioner Guillermo,
Yes.
and Commissioner Chung.
Yes.
All right. Thank you all so much for the meeting today and your patience hanging around. And again, happy and healthy New Year to everybody.
And Happy New Year, and apologies again, Ms. Louie, for bumping you from the agenda. So let's hope that next month this can go smoothly. Thank you.